Welcome back to our coverage at the American Psychiatric Association Annual Conference. We're celebrating 175 years of psychiatry. We wanted to feature and focus in on cannabis right now. I'm with Dr. Deborah Hassan, who is an epidemiologist, a professor of epidemiology at Columbia Psychiatry, and really one of our experts on understanding what's happening in terms of cannabis and substance use in America. Thank you so much for joining us here on Medscape.
No, I'm happy to do it.
Can you tell us, Deborah, a little bit about what is changing and what's different in the landscape? It feels that all of the clinicians watching, I know in my practice, I'm just getting an incredible number of questions about cannabis, CBD, whether they can use it, that it works, and I'm not sure what's changing, and maybe you could specify that for us a little bit.
So there are a lot of things changing, actually. So if you think back to 30 years ago, there were no states that had legal marijuana use either for medical or recreational purposes. And if you fast forward to today, we have 2/3 of U.S. Citizens in states that have medical marijuana laws legalized, and about 25% in states with recreational laws legalized. The number of Americans who think that marijuana is a harmless substance has gone up sharply in the last several years. And I think it's certainly a point worth making that, while a lot of people can use marijuana safely without harm, just as a lot of people can drink alcohol without harm, cannabis is not a risk-free substance. There are risks involved in using it, and we see time trends increasing in some of those risks as the number of Americans using cannabis goes up over time.
What are the big risks that clinicians need to be aware of? Because I'm often surprised that this doesn't get discussed as much as I would think.
So one of the things that's perhaps most obvious that not everybody knows about is the risk for cannabis use disorder. So people assume that cannabis is not addictive, and it may not be as addictive as opioids, for example, but there still is a full syndrome of cannabis use disorder, including cannabis withdrawal, which is included now in the DSM-5. It also involves risks in terms of driving. The number of Americans that are driving under the influence of cannabis is increasing, which has risks for vehicle crashes. We know that we have new findings coming out that in people with pain, non-medical cannabis use is increasing, and the association is growing stronger over time. And there's a relationship between using cannabis and developing psychosis, especially among people that have risk factors like a family history of those kinds of problems.
In terms of us screening for patients and trying to better partner with patients, it feels that as a field we've been very risk averse and really want to focus on the problems, and that's a little out of step with where the public is sometimes and where our patients are sometimes. How do you talk about and recommend we talk about the risks, especially when it comes to psychosis?
I think acknowledging that marijuana or cannabis isn't a horrible substance for everybody is a good starting point, because then it's acknowledging that there's some room for discussion, but then saying something about the risks and having a meaningful discussion about what those might be could be a good way to at least get a conversation started.
In terms of, you said 25% is in a recreational state. Is that so? A quarter of America has access legally. That's a huge amount of cannabis that's going out into the population. What do you think is going to happen?
In those states or other states?
In those states.
Well, that's a great question. So we have a paper. The people I'm working with on this, we have a paper that's under review now. There haven't been that many years of data available for recreational marijuana laws because the first ones were only passed in 2012. So in terms of national data, that's not that many years. But the findings in the paper that's under review now show that cannabis use overall in adults, frequent use, near daily use, and cannabis use disorder has increased more in states that enacted recreational laws than in other states. So it suggests that these laws are having an impact.
More people are using. Now we talk a lot about the use in the risks in psychotic disorders, but also there's an effect in mood disorders and comorbidities with other substance use disorders. For a lot of time, marijuana was framed as this gateway drug. And so I'm wondering if you can comment a little bit on other disorders, and also if it is that in some ways that it facilitates people getting into other substances.
there's a lot of controversy about that, and certainly in adolescence, we saw a switchover 4 or 5 years ago, with tobacco no longer being the first substance used by teenagers, but cannabis being the first substance used.
Really?
Yeah, so now people worry about a cannabis tobacco gateway effect. I think with regard to other psychiatric disorders like depressive disorders that you mentioned, so if you look at the diagnostic criteria for cannabis withdrawal, a lot of those symptoms are almost exactly the same as symptoms of major depressive disorder. And sometimes people could be using cannabis thinking that it's self-treating a depression. And what they may actually be experiencing if they're using cannabis every day is that when it wears off, they start to get some withdrawal symptoms. It feels like depression, so they use it and those symptoms go away, but they may actually be perpetuating an ongoing withdrawal syndrome. So that's something else to think about for clinicians.
Well, thank you so much for all of this great information. I'm here with Dr. Deborah Hassan of Columbia Psychiatry, Professor of Epidemiology, talking about some of the big changes that are happening in all of our clinical practices where patients have increasing access and increasing use and changes in use patterns. Thank you so much for the information about some of those risks. And I think that encouragement that we be flexible when we meet our patients and understand there are people who can tolerate this, there are people that can't, and on the clinical side, it's our job to distinguish who's who and do our best to get people towards health. Thank you so much.
You're very welcome.